Hey everyone, it's Nurse Dani. Each week I receive questions and respond to them with either a written or video response. Here are answers to some of the questions you asked during this week. Most babies are ready for solids by 6 months of age, and some pediatricians actually recommend starting a little bit earlier, like between 4 and 6 months, depending on a baby's growth and their overall nutritional needs. But once your baby is ready for solids, a lot of parents are really confused about how to go about it. And really, you can start with anything, single grain cereal, fruits, or vegetables, and just pick one meal of the day where you're going to introduce solids. So eventually, by about 8 months of age, you want them eating solids for breakfast, lunch, dinner, and for 2 snacks during the day, 1 in the morning and 1 in the afternoon. But this is a gradual process of introducing solids. So it starts with just one meal. And really, you might just give your baby a couple of spoonfuls at first and see how it goes. And you should just pick one food, give that to your baby for 2 to 5 days so you can watch for signs of an allergy. And then once they've, gotten that meal down, then move on to the next. And it could take a couple of weeks before they really like solid foods and you start introducing it for another meal of the day. And again, eventually just remember, let's say you started with breakfast. Once they get breakfast down, then introduce lunch and then dinner and then snacks. Also be sure to encourage fluids after the solid food feeding. So give your baby a couple of spoonfuls to start out with, see how it goes. If they like it, you can keep feeding it to them, and then follow it up with a nursing session or a bottle. A lot of women go to their routine doctor's appointments just for a normal checkup, and their doctor talks to them about a pap smear. And this involves getting in the stirrups. The doctor pulls out a metal speculum. It kind of looks like a duck beak, and they swab inside up by the cervix, which is just the lower part of the uterus. They send that off to the lab and wait for the results. If you have a normal pap smear, then you only have to have one every 3 years between the ages of 21 and 29. Women who are 30 or over can have a pap smear done every 3 years, or a pap smear and an HPV test done every 5 years, depending on their results in the past and their doctor's knowledge of their circumstances. They might have other recommendations depending on your history. If your pap smear test comes back abnormal, it's basically just flagging it. It means that your doctor will want to follow up and do additional testing. It doesn't necessarily mean that there are precancerous or cancerous cells. Your doctor will do additional tests, and then if those tests come back as precancerous or cancerous, know that there are a lot of treatments that can be done, and we have good outcomes for cervical cancer these days with all of the technology we have. Again, this goes back to the importance of getting screened as often as your doctor recommends, because it's all about early detection. Early detection equals better outcomes. You mentioned that your 1-year-old little boy will drink milk, but only from a bottle, and he won't hold it on his own. So I had a couple of thoughts when I read your question. First of all, when it comes to weaning a baby from the bottle, there's a couple of things you can do to encourage it. For one, you can try watering down the milk you put in the bottle because it won't taste very good, and then just put 100% strength milk in the sippy cup. You can also add flavoring to the sippy cup milk, maybe chocolate or strawberry to make it a little more enticing. And as for temperature, it sounds like your little one is used to room temperature milk, and so he doesn't like the cold stuff that comes from the fridge. A lot of babies get used to warm milk because if they were nursing in the beginning, they're used to warm milk. It comes from the mother's body at room temperature, or even sometimes a little bit warmer than that. And so if they switch to formula, the mother uses warm milk, and then it's hard for them to adjust to colder milk after their first birthday when they're drinking whole milk. If this is the problem that you're running into, then the best thing to do is to give him cold milk from the fridge for a few days until he learns that that's what it's going to be from now on. Now, you also mentioned that your son will hold a bottle, but he won't hold a sippy cup, and it could just be preference, but I do recommend talking with your pediatrician about it, because by about a year of age, a baby should have the dexterity or ability to hold a sippy cup and bring it to their mouth. And so after your pediatrician asks you more specific questions about your observations and actually observes your child doing that, they'll be able to decide if it's normal, maybe just pickiness, or if maybe further investigation is warranted because he lacks the dexterity to do so. You mentioned that you gave your 2-year-old little girl pecans, and you're wondering if that was bad. And in and of itself, it wasn't bad to give her pecans, because the pecans themselves won't be harmful to them unless she had like a nut allergy or something. But giving it to her is not going to increase the chances of her having an allergy. The biggest concern is choking. Nuts are considered a choking hazard, and the American Academy of Pediatrics recommends that children under the age of 4 don't consume nuts or seeds. And other things you should watch out for include hot dogs, grapes, raw carrots, really any type of food that could get lodged in their throat. Fruit snacks have even been associated with choking. So it's always best to just make sure that the food you're giving your child is the appropriate size and that they have teeth to chew it if it's a little bit harder. And just be present when your child is eating so that they don't choke and they're unsupervised. This is the age where children put a lot of different things in their mouth too, where you have to kind of follow them around and keep the floor vacuumed and keep small pieces out of their reach. So just do a general sweep of the room when you put your child down on the floor and make sure that there aren't buttons, balloons, small toys that they can fit in their mouth, marbles, bouncy balls. Really, any small object that they can put in their mouth, just get it off the floor and out of their reach. Keep them distracted with toys that are larger and more age appropriate. I hope you found these tips helpful, and if you'd like to see more or have more questions ranging from preconception to pediatric health, be sure to like this video, like our Facebook page, and subscribe to our YouTube channel by clicking on this link.